a DMP-guided program for prevention strategies for seasonal influenza. This project was a collaborative effort between Jesse Lankford and Jessica Chavez for clinical prevention and population health. The objectives are to go over what the flu is, its risk factors, symptoms, and modes of transmission in all populations. We will then describe elements to prevent the flu and the 2 DMP competencies used in our prevention plan. We will then identify data used to assess and measure the success of our plan. Influenza is a contagious respiratory illness that infects the nose, throat, and sometimes the lungs. It can be mild and severe, from hospitalization to even death. It usually comes on suddenly, and it's different from just a normal cold. There's 2 types of influenza viruses that spread in people, influenza A and influenza B. There are many high-risk populations. These include adults 65 and older, pregnant women, anyone with weakened immune system or chronic diseases such as heart disease, lung disease, asthma, diabetes, heart failure, HIV or AIDS, and cancers. Young children are also affected. Unfortunately, people 0 to 17 years old are 2 times as likely to get the flu than a normal healthy person. Influenza symptoms include fever, chills, cough, sore throat, runny or stuffy nose, muscle and body aches, headaches, fatigue, and in children it's common to have vomiting and diarrhea. These symptoms can spread primarily person to person through droplet transmission, so anyone coughing or sneezing near a susceptible person can transmit the flu. Transmission requires close contact between the source and the recipient because droplets generally only travel about 6 feet or less through the air. It is less common to be spread through indirect contact, but it can happen from viral contaminated surfaces or objects to mucosal surfaces of the face. It is most contagious for the first 3 to 4 days after the illness begins, but some people may not even notice symptoms for a day and have already spread it to others. After symptoms occur, the flu usually lasts 5 to 7 days. In the high-risk populations, it can last even longer, sometimes even up to 2 weeks. The season typically is early October and can last all the way until May. It usually peaks between December and February. The peak and end of flu season varies each year. On average, about 8% of the U.S. population gets sick from the flu each season, with a range between 3 to 11% depending on the season. The 3 to 11% range refers to people that have symptomatic flu symptoms. Our focus in this presentation is primary prevention. Primary prevention refers to the process of altering susceptibility or reducing exposure to susceptible individuals and includes general health promotions and specific measures designed to prevent disease prior to a person getting disease. An easier way to put this is primary prevention main focus is preventing the onset of the disease. Primary prevention is the early detection and prompt treatment of a disease at the earliest possible stage. This would include going to the doctor immediately, recognizing symptoms, and then being treated with antivirals or Tamiflu. They are also able to do rapid flu tests because it can be hard to distinguish bacterial versus viral infections. Primary prevention uses strategies to prevent disability and to restore effective functioning. In the case of influenza, this would refer to compliance, rest, and hydration to keep from worsening. Again, our focus is primary prevention, but this is what secondary and tertiary prevention would take part in. Primary prevention for the flu, the number 1 primary prevention is vaccination. It is also important to avoid close contact with sick people, and if you yourself are sick, to limit contact with others to keep from infecting them. It is also important to cover your nose and mouth with a tissue when coughing or sneezing, because this is how it's spread, by droplets. The second most important prevention is washing your hands often with soap and water. Alcohol-based hand rub is also acceptable when soap and water isn't available. Avoid touching your eyes, nose, and mouth when sick, because this is the way the germs are spread. Clean and disinfect surfaces and objects that may be contaminated. This picture emphasizes ways to fight the flu. There are many advertisements and education used in flu campaign. Some common examples are Publix offers $10 gift cards. Many drugstores offer perks if you get your flu shot done. It's free for all employees. And in our workplace, there's signs in the bathrooms and all over the hallways that advertise flu shots available. It is required in all healthcare environments. And then we also assess our patients on admission. Every single patient that is admitted, if they have not received it, they are offered it if it is something that they would like. If they do refuse the vaccination, it is very important for us to educate and harp on the importance of administration of the flu vaccination. Flu in children includes the influenza vaccination, which is approved for all kids 6 months or older. If the children are up to 8 years old, they're required to have 2 vaccinations, the first being when it's first available, which is typically the end of October, and the second 4 weeks after the initial vaccination. It is important that we educate and have public awareness campaigns to explain the benefits of the vaccination and ensure parents know how safe it truly is. School-based vaccinations are also offered to increase convenience for both the children and the parents. We educate kids on improving hand hygiene and limiting social contact in public areas and within schools. Influenza in the elderly is also very significant and important to this population. Unfortunately, the elderly are the ones that have the higher complications, hospitalizations, and even death. The primary goal is to get the vaccination in the elderly to reduce the risk of death among this entire population. Elderly can also get pneumonia secondary to influenza, which is the reason that we see these higher mortality rates. The benefits of getting the flu vaccination on the front end of flu season. It helps us from getting sick with the flu. It reduces the risk of flu-associated hospitalizations for children, working-age adults, and older adults. It helps prevent serious medical events associated with chronic conditions. It protects women during and after pregnancy, and it can even be life-saving in children. In those that still end up getting sick with the flu, it is shown that it does reduce the severity of the illness when infected. Last but not least, it protects people around you, including those who are more vulnerable. Disciplines we involved in the primary prevention plan include DNP nurses, pharmacists, health department nurses and employees, clinic nurses and physicians, and then medical assistants. DNP nurses organize and monitor influenza vaccination prevention plans. The pharmacists are available for medication management over the vaccinations and compliance. Health department and clinic nurses administer and educate flu vaccinations, and the medical assistants check in with patients as needed. It can be given at urgent cares, health departments, your local pharmacy, or drugstore. It's given within hospitals and also doctors' offices. The first DNP competency that we used in our prevention plan was communication. It's important to communicate the ideas, make our point effective to resistant audiences, and encourage direct and open discussions about the importance of preventing the flu. Project management. It took organizing tasks and projects effectively, prioritizing the tasks and projects, and we can also help employees organize and prioritize these projects within whichever setting they are in. To measure the success of our project by using FluView, virus characterization, and health laboratories. FluView is a weekly report prepared by the Influenza Division. It can change and it does change as more reports are received. It can be checked weekly to see where the flu is more prevalent. Virus characterization collects, compiles, and analyzes data to monitor influenza activity throughout the year and over time. This year, the influenza virus is very low in the U.S. Health laboratories is reviewed in the months before flu season and covers the components and strains related to creating the most effective vaccination. Clinical labs also give us percentages of specimens tested positive for the flu. This gives us an image of how many patient specimens are tested to make the vaccination the most effective. We are then able to analyze the flu nationally using hospitalization surveillance, mortality surveillance, outpatient illness surveillance, and then a summary of geographic spread of the flu. Each surveillance has a specific organization that keeps up with the data. These organizations give us national percentages and also individual state percentages. And all influenza activity reporting is voluntary. It can be reviewed to determine if any high-risk medical conditions are recorded in the chart at the time of hospitalization, because this does play a part in the severity. Again, when people are hospitalized, it is important to ask the question, have you received the flu vaccination? It should be assessed on every admission when someone is hospitalized, and it is important to educate so that it can be given. In conclusion, the flu is a respiratory illness caused by the influenza virus. It causes symptoms worse than a cold, not feeling well, coughing, fever, chills. It also takes many interdisciplinary efforts to make the vaccination and administration possible. Primary prevention is the preventing of the onset of the disease, and in this case, our prevention focus was preventing the flu. Our plan included educating and ensuring people are aware of the vaccination, things it can do to prevent the flu, and other things such as simple hand washing. It was also important to educate on understanding the significance and reason it is so important in the high-risk populations that we went over. We were then able to assess our plan by using data in our own community and continuing education to prevent further spread. We are able to collaborate with other interdisciplinary providers to apply the most recent evidence-based practice in flu prevention. References and articles used in the presentation.